leukemia, leg ulcers, MRSA, right? When we talk about MRSA, it's going to be your contact isolation. It is a bacteria. We're going to be treating it with an antibiotic. I know I'm skipping a couple of these. These are just repeats. So melena is your term for black tarry stool. It is a sign of GI bleed. So whenever we talk about GI bleed, I want you to note that the higher the bleed, and we're just talking about stool. The higher the bleed, the darker the stool because it's getting digested. So melena is black tarry, meaning the bleed is up here versus a bright red stool, the bleed is somewhere closer to the rectum. All right, nephrotic syndrome. When we talk nephrotic syndrome, remember one thing: protein, peeing out protein. Nephrotic syndrome is the kidney is peeing out that protein. No, are we replacing it with a lot of protein? No, you have a specific diet you want to follow. You want to follow a low sodium diet, moderate protein, limit fat and cholesterol. Okay, limit fat and cholesterol. Whenever we have nephrotic syndrome, protein is one of the components that holds blood into the vessels and not lets it leak out like pitting edema. If you lack that protein, blood leaks out or fluid leaks out into the interstitial space, which is your pitting edema. That's what it's going to look like. I have a list of opioids here for you, right? Just familiarize yourself with opioids: morphine, codeine, fentanyl, hydrocodone. Now, most common side effects, number one, opioid is a CNS depressant, central nervous system depressant. So drowsy, altered, tired, these are the most common side effects, or a kind of expected side effects, right? But some things we got to watch out for: respiratory depression. An acute phase, that's your emergency. It lowers down respirations. Long-term phase, it slows down the GI system as well because it fogs your system, right? Slows down the GI system, you're going to watch out for constipation. Okay, osteoporosis. Remember this nice little lady right here. This is the most common type of individual affected with osteoporosis. Skinny, female, Caucasian, smokes, drinks, and is in menopause. And one of the things that steroids does, chronic use of steroids, is it lowers bone density. So these are things you got to watch out for. These are the people at risk. Now, sign and symptoms. There are common sign and symptoms. You have the kyphosis, or that hunchback, lower stature, and one of the biggest symptoms as well is that they get what we call pathological fractures, which is fractures that are of an unidentified source. Pancreatitis. So pancreatitis, you want to note down that two biggest causes that you're going to watch out for is usually alcohol use and gallstones. Alcohol abusers, big risk for pancreatitis. Okay, so just watch out for that as well. Now, what are your signs of pancreatitis? Number one is going to hurt, so know where the pancreas is. Epigastric, meaning your middle region, or left upper quadrant, because it extends that way. But your pancreas extends a little bit that way, middle to left. So know where it is. Two classic signs you're watching out for that is specific to pancreatitis is your Gray, Turner, and Cullen's. What is that? Cullen's is your umbilicus. There's bruising in the umbilicus. Gray Turner is bruising on the side flanks. All right? Those are your classic signs. Peptic ulcer, when you say peptic ulcer, that's an ulceration in the stomach. If at any point NCLEX asks you what type of bacteria, it's going to be your H. pylori bacteria. Now, when is it a problem? The peptic ulcer can eventually perforate or develop a hole and it starts bleeding. That is when you watch out for that GI bleed and tarry stools, okay? Or melena. Parkinson's medication. We had a nice little lecture on Parkinson's. Parkinson's is a lack of dopamine. So what are you giving? Dopamine. Carbidopa, levodopa, the two big things you give. Now, what do you want to know about carbidopa, levodopa? Number one, it takes 2 to 6 weeks to even have an effect. So it's low onset, 2 to 6 weeks to take effect, right? What you're teaching them, it has an anticholinergic effect. If you remember a lecture, anticholinergic, you what? Can't see, can't spit, can't pee, can't poop. You're dry, dry, dry. So anything that's wet becomes dry. Those are the things you're watching out for. Okay. Let's see. Antibiotics, prostatectomy, pneumonia, hypoxia. Know your signs of hypoxia. Okay, know your early and late signs of hypoxia. Here's a note. Cyanosis is not an early sign. Your earliest sign of hypoxia is going to be your restlessness and irritability. That is always the earliest sign. Increased respiratory rate comes a little after, and then hypoxia is a late sign. Psoriasis. I personally am not an expert in anything integumentary, because whenever I practice with my nurse practitioners in the urgent care, I still refer to my integumentary book all the time. Psoriasis is a very classic skin condition though. It has classic symptoms. Here it is, right here. Thick, white, silvery patches. White, silvery, red patches. As soon as you see that, psoriasis. Most common, psoriasis. Okay. So radiation is going to function the same as your chemo. It has bone marrow suppression, but think about that site itself. If you're shooting radiation in a skin site, you're going to watch out for that skin, right? So protect the skin at all cost, right? Watch out for any skin breakdown, no lotions, no powders, no ointments on the skin. Okay? Raynaud's. So if you remember back in fundamentals, we talked about two things, Raynaud's and Berger's syndrome. These are both types of peripheral arterial disease. What do we mean by arterial? Arterial means there's no flow to the area. Raynaud's and Berger's, both arterial diseases, but both different causes. Raynaud's is caused by cold. Berger's is caused by smoking. So Raynaud's specifically, let's talk about Raynaud's. It's caused by cold conditions, meaning cold environment. So the biggest thing you're going to be teaching your patient is how to stay warm. Whenever they're taking out ice trays, they got to wear mittens. Whenever they're going out, wear mittens. Avoid cold environments. That's the main thing. Subcutaneous, you guys should be experts on this by now, right? Whenever you give a subcutaneous shot, 45-degree angle, heparin. Heparin is always given subcutaneously, unless ordered IV, but always subcutaneously, all right? Spirulactone, when we talk about spirulactone, we gotta watch out for, what is spirulactone anyways? It's the diuretic, but it has a specific type of classification. It's a potassium-sparing diuretic. So you talked about your Lasix, which pees out potassium. Spirulactone spares it. So what do you gotta watch out for? High potassium. Right? Again, watch out for that hyperkalemic symptoms right there. So whenever edema, right? One thing we use to treat it, spirulactone, but that's what you gotta watch out for. Sputum, stasis ulcers, you guys should be good with this. Suctioning, seizures, right? So general rules for seizures that we talked about. Never leave your patient alone, right? Monitor the type of seizure. Note how long the seizure is. The type, simple absence. Protect the patient, right? Pad the side rails. Turn them to the side. Nothing in the mouth. So know what you do for a seizure, but know that simple seizure itself, it's when they start daydreaming or blanking out and they don't remember a thing. Usually in 15 seconds, it's about over, and usually a childhood type of seizure. All right, total hip replacement. Whenever we have total hip replacement, there's two things that we want. We want abduction, meaning we want to separate those hips. We don't want it adducted, ADD. No adduction. Adduction means crossing. We never want those hips to cross because you'll stay crossed and they'll never uncross. So what do? Prevent adduction. Put a wedge in between those two legs. That's called an abductor pillow. Put a pillow in between those legs. That helps prevent that adduction. So thyroidectomy. So whenever we have surgery in our thyroid, just note that one thing that follows along is not just the thyroid, but we remove what we call the parathyroid as well, because there's 4 little things that attaches to your thyroid. So what do we watch out for when we remove the thyroid? One thing we watch out for is, number 1, hypothyroidism. But one big thing is the hypocalcemia again, because one of the jobs for your thyroid is to help build that calcium up. Right? So if we have low calcium, hypocalcemia, muscle spasm again, right? Tetany, chavostics, trousseaus. Those are the things you watch out for. Okay, we talked about your seizures. Let's talk about TURP. Transurethral resection of the prostate. So whenever we have an enlarged prostate for males, one surgical intervention is TURP, right? Discharge planning for TURP, you're going to teach your patient, it is a surgical site. So what do they want to do and what do they not want to do? So anyone with surgery, just keep in mind, no strenuous activity for a couple weeks. limit their activity, decrease that pressure caused on that site. No alcohol, no smoking, no caffeine, all right, for these patients. We don't want to increase pressure on that site. And note down signs of bleeding. Prostate releases to urethra, right? Hematuria, right? Urinary retention. Urinary retention is just swelling of the area where they can't pee. Those are the things we want to watch out for. You guys are well aware of this. Urolithiasis. Urolithiasis, or a formation of a calculi, is just kidney stones, right? So note down classic signs of a kidney stones. Flank pain is the biggest sign. Back pain, severe back pain. It's very, very painful, right? Note down those signs. And what our main treatment is, increase fluids and let them pee the stones out. Now, there's a couple steps we can take after that, but those are your main things. Priority is identifying and increasing fluid and straining the urine. Okay, chest tubes. When we talk about your chest tubes, there are going to be two sections of your chest tubes, right? A water seal versus a suction chamber. Now, what do you do if there's a problem with your chest tube? You guys automatically want to just fix that chest tube. No. Assess. ADPI. A. Assess. Check the patient. Check the equipment. Patient first, then check the equipment. If they're both okay, all right, let's troubleshoot. Water seal chamber. Water seal chamber is supposed to tidal every time they breathe. Bubbling is a no-no, right? It's only tidling. Bubbling is good on the suction chamber. That means some intermittent bubbling means something suctioning out. Now, what happens if there's no tidling? Two things you're going to watch out for. Number one is there a kink in the tubing? Meaning, is the tubing kink where the breathing can't be sensed? Or maybe the lungs are fixed. That's another sign that the lungs have reinflated, and we can probably call the doctor to take out that water seal, or that chest tube.